There are many causes of shortness of breath. It can be related to the heart, it can also be related to the lungs, and it may also be related to other situations such as a low hemoglobin or anemia. From the cardiac perspective, shortness of breath is often associated with heart dysfunction, which is a condition where the muscle of the heart is not pumping as well as it should be. In addition to this, other cardiac issues can also cause shortness of breath, such as problem with the valves, as well as heart rhythm issues or palpitations. Sometimes even a situation such as angina, which is a problem with the blood supply in the heart, can also cause shortness of breath. Usually from the cardiac perspective, shortness of breath most commonly occurs with physical activity, such as walking up the stairs or walking up inclines or any situation where more exertion than normal is anticipated. If the shortness of breath is very sudden and new, it would be unusual and something to worry about. If the shortness of breath occurs with something like a cold or a chest infection, it can be explained by that. However, if shortness of breath occurs suddenly, you should seek medical advice, especially if it is accompanied with chest pain. The other type of history of shortness of breath is something that develops more insidiously and more gradually, maybe over the course of a number of weeks or even months. If you find that you are less able to do the activities you were able to do before, such as walking or even exercise, this is something that should be investigated and you should seek medical assistance to try and understand why this has happened. So the cause for shortness of breath at rest can depend upon a number of different factors. If it is a cardiac cause, it could be that the cardiac dysfunction is quite significant, and as a result, there is shortness of breath even with minimal activity. Sometimes, from a cardiac perspective, if the heart is racing or if there are palpitations, this can also be manifest as a feeling of breathlessness. Other non-cardiac causes can also cause shortness of breath at rest, and these can include situations such as anemia, where the hemoglobin is low, and it can also occur for respiratory causes, for an intrinsic lung problem as the cause for the shortness of breath. So anxiety and shortness of breath can cause a number of different symptoms. One of these symptoms is shortness of breath. This shortness of breath can occur suddenly, or it can occur if somebody is in a stressful situation. If the shortness of breath is associated with a sensation of palpitations or the heart racing, this can also indicate that this is a stress-related event. Alongside this, there can sometimes be tingling in the fingers or also tingling around the mouth. These are other symptoms that are often described as being anxiety related. So before going on to test, the history is extremely important in trying to determine whether the shortness of breath is likely to be heart related or lung related, or even related to a blood abnormality such as a low hemoglobin. A common test, if we think this is heart related, would be an ECG. Alongside this, we might also perform an echocardiogram, which is an ultrasound scan of the heart. The ultrasound scan of the heart takes around 45 minutes and is a non-invasive test and very quickly identifies any problem with the heart structure or function that may be causing shortness of breath. Alongside this, it would be routine to undertake blood tests to determine if there is evidence of anemia or any other condition that may be causing shortness of breath. A chest X-ray may also be requested in this situation. Depending upon these results, Further advanced imaging, such as a cardiac MRI scan or monitors of the heart rhythm and blood pressure, may also be requested.